this event with the prayer first. Uh, kita berdoa menurut keyakinan masing-masing. Dipersilakan. Bismillah. Terima kasih. Thank you very much. Kita boleh guna English, boleh guna Malay language, boleh juga guna bahasa Indonesia. Tapi jangan digunakan bahasa Tagalog, bahasa Jawa, bahasa Sunda. Saya tak faham juga. Bahasa Arab pun tak payah. Kalau bahasa Arab boleh sukron aja boleh lah. Okey, jadi kita guna English boleh, Malay language boleh, bahasa Indonesia pun boleh. You kena mix pun boleh. Tolong kawan-kawan menjaga you punya sound supaya you boleh mute because mic only the speaker will be to use. Okay. The first appreciation to Ibu Anita Soekarno. Ibu Puan, kalau you lihat ada escape itu bermakna sarjana keperawatan atau nurse. And then MSc dalam pelaya itu Magister Sains dari Ibu Anita. Itu dalam bahasa Indonesia. S itu
Ibu
sarjana.
ngapain anjir?
Sarjana keperawatan, nursing. Beliau juga ada sertifikat nurse. Kemudian juga Magister Sains. Kalau dengan Ibu Nuraini itu ada STR CAP. Itu sarjana applied kebidanan midwifery. Ada MKM, Magister Kesihatan Masyarakat, Public Health, maksudnya macam itulah. Okay, and then thank you for Puan Mas Miza binti Zainul Abidin for available time. You will to share today food care for diabetic patient, and Ibu Anita will be to share about his topic. And then we start tanpa membuang masa lagi. Indah Gumilang will be to share the short video about RLC.
Okay. Okay, Professor, thank you very much for this opportunity for me. And this is my second series, right? To discuss with you all regarding the topic. And before I deliver my presentation, let me share it first.
Okay, very clear your screen right now in the but yes, with the good color.
Okay.
In pricing. Okay, very clear.
Okay. Well, today's topic, because last time we agree that we are going to talk about diabetes. Therefore, I would like to share about how we increase health literacy across undiagnosed diabetes population as a major challenge in Indonesia. And before I talk more about that topic, this is my outlines. The first one, I would like to share about diabetes data in Indonesia. The second content is about diabetes program in Indonesia, and then what are the diabetes self-care activities, and the fourth one is I would like to share about my research findings that I already published with my team, and the last one I would like to share about social activity program regarding diabetes program in Indonesia. And well, this is the first my first slides. And according to International Diabetes Federation 2021, can see that according to the level of income across the countries, Indonesia itself is belong to the middle income countries, and we can see the number of people with diabetes around 414 millions, and it will be projected will increase in 2045. And I think this can be a good reason why we should focus more on non-communicable diseases. And I think in Indonesia itself, uh, Indonesia big uh, is the prevalent country with diabetes, and I'm a little bit surprised because 2 years ago Indonesia is the seventh prevalent diabetes country. However, uh, right now into 2021, the latest data, it show Indonesia is the fifth prevalent diabetes country, which means that Indonesia has more population with diabetes diagnosed. And according to, I would like to share one of the previous published research about modifiable and non-modifiable and psychological risk factors of non-communicable disease in Indonesia. And this evidence was derived from Indonesian basic health research. And we found that almost 10% respondents in Indonesia had NCDs. And we know that Indonesia is one of the biggest population country in the world, and we have about 270 million people live in Indonesia, which means if we if we try to find out how many people in 10%, it will be very huge number of populations. And we found that the risk factor for having diabetes, we found that people with no education and also had depression, and if they are passive smoking, eating a lot of fatty food and burnt food, and also food with preservatives food and seasoned food, and also living in an urban area and central Indonesia, as well as being a female and obese, are the um, riskier populations to have diabetes itself. And according to this finding as well, people in Indonesia who undertook vigorous activity and had employment and also had access to improve sources of drinking water and were productive age were less likely to develop NCDs. And I think it is very related to our today's topic in terms of literacy, because I think uh, if we if we had employment and also we have access into the sources of health services, we may have lower risk of diabetes. And yes, and as I said previously about health literacy, we have to define health literacy first. And according to Center for Disease Control and Prevention, we define health literacy as a degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and action for themselves and others. That means that how to make our populations realize that to be actively participated to access the informations is really helpful for them, and we have to use those kind of informations to build an action and to have a better self-care to prevent diabetes itself. And according to previous research as well in Indonesia, this research found the positive association between diabetes literacy and self-management among older people with type 2 diabetes mellitus, and we indicating that if those diabetes type 2 patients have good diabetes literacy, they may have a good quality of self-management to take care of them. And I think nowadays we know that many media and also information that are easily taken from a lot of resources. For example, like social media, not only from television, like in the past, right? So we have our social media that may improve our resources to access many informations. And I think according to this research, in Indonesia, the level of health literacy it's not really bad because we identified that many people already know how to access information from magazine, books, radio, television, and also the internet itself, and other kind of media like printed media like newspaper, magazine, brochures, posters, and also they may access many information from their family and friend as well as from healthcare providers, not only in the main hospital, but also we have like a primary health services that really closer to our community. Therefore, Indonesia population uh, has have a good quality of health literacy. And what kind of health literacy should be obtained for diabetes population? I think one of the fruitful information is to find out what are the self management for diabetes population itself. And according to American diabetes educators, we find out many comprehensive self-management should be included in the diabetes program, not only about medication and also healthy eating. However, American diabetes educator also emphasize about healthy coping, healthy eating, being active physically, and also taking medication, monitoring blood glucose, and also reducing risk of complication, as well as we have to teach our people how to solve their problem related to minor and major complication related to diabetes, as well as how to manage our stress when we overcoming self management itself. Therefore, what am I going to say is diabetes self management is not only about healthy diet and taking medication, but also we should improve emotional state while receiving regular self management as diabetes population. Well, next topic I would like to share about diabetes care program in Indonesia. Actually, we have a chronic disease management program in Indonesia. We call it Prolanis, program penyakit kronis. And this program actually developed by our health ministry in Indonesia, and it is covered by Indonesia Health Insurance. And in this program, we have many diabetes programs such as health education, health checkup regularly, and club activity like we are doing exercise together every month or even every 2 weeks. And also we doing a home visit, and we have a reminder program using short message services, and also we have medication services, and we do have a specialist physician control. And actually, this program is very advantageous for diabetes people because this program is regularly conducted in primary care services, which is very close to our people. Therefore, if we do it regularly, they may visit this program together with other diabetes patients. Therefore, I think it could be the program with a good support system. And and right now, actually, because many application have been built, we also develop our program, our Prolanis program, into an application that can be downloaded through our phone. Therefore, our patients are easier to get to engage Prolanis program through their phone. And I think this program is really a good program to increase health literacy among those diabetes patients. Well, I'm sorry.
Mhm.
And then I would like to share about our research findings. Actually, in Indonesia, I don't know in Malaysia. However, in Indonesia, despite of lecturing and delivering course in the class, we actually have an obligation, and this is really required for us, not only lecturing, but also we should conduct many research per semester, and also we should do a social activity, and it should be reported every semester. Therefore, this moment I would like to share about our research finding that have been published uh,
Mhm.
by us, me and my team research.
Mhm.
Well,
Please.
actually, we already conducted the program, and we collaborated with primary care services to conduct a telemonitoring program, and we targeted the diabetes populations. And actually, this research developed conducted in the pandemic. Therefore, I think this telemonitoring program can be very advantageous, because when we faced pandemic situation, we were restricted, right? We should do isolation, and also we do the social distancing. Therefore, doing the telemonitoring program is really advantageous for our diabetes populations, because according to previous information that I explained about Prolanis, is conducted every month, or even twice a month, and the
Mhm.
patient should come to the primary care services, right? However, during the pandemic, the patient should not come to the primary care services, because to prevent the infectious of COVID-19, right? So I collaborated with primary care services to conduct telemonitoring program for diabetes people. Therefore, um, we found that telemonitoring program can improve blood glucose, which is fasting blood glucose, and also diabetes knowledge among diabetes patients. And I'm so happy during this research, because many patients said that this program really helpful, and they can access many information by texting us using WhatsApp, or other kind of social media like Telegram. Therefore, they may approach the provider uh, healthcare provider. And then this is our second findings, our second research. Well, this is my research, and we did concept analysis, and we found that religiousness are really associated with type 2 diabetes care management. and and according to this concept analysis, we found that many attributes of religiousness role in diabetes care management, such as religious beliefs, religious practices, religious support, and religious coping. And we found that religious beliefs for people who really believe into their religiousness, they believe that having diabetes is uh God's willing, and they believe that if their God give them diabetes, the God also give them the solution how to take care of diabetes. Therefore, religious beliefs increase patients' beliefs towards the diabetes solutions. And the second one, religious practices. Uh, One of the religious in here, for example, like as a Muslim, we may have several activities that may improve our diabetes self care, such as fasting. And according to this concept analysis, many patients believe that by engaging in fasting, regular fasting, they may improve their blood glucose level. And other kind of activities like preventing smoking and alcohol also increase their health quality level. And the third point here about religious support, well, in Indonesia, actually, we have like community gathering, such as we called it Majelis Taklim. Therefore, patients may come to this activity and they may share their experience regarding diabetes. Therefore, they may give many suggestions, and they may obtain many positive suggestions from their friend, and they can share together. Therefore, religiousness may increase the level of uh, group support for these patients. And then the last one, religious coping. And of course, by doing a religious activity, they may find a lot of friends who have similar situations, right? Therefore, this kind of activities may improve their adaptive coping for overcoming diabetes self-care. And the third findings, I found that by doing a systematic review, we found that the effectiveness of cognitive behavioral therapy to reduce psychological stress and improve physical health and also improve self-care behavior. However, unfortunately, I don't know if this cognitive behavior has been conducted among diabetes patients. However, this CBT or cognitive behavioral therapy has been conducted among psychiatric diagnosed patients or a patient with psychiatric diagnosis. And this program has been found to improve depression, anxiety, stress, and other diabetes related stress, as well as decrease their blood glucose level and improve self-care behavior. And I hope this program is not only conducted among psychiatric illness patients, but according to this systematic review, I hope this program may be one of the solution to overcome a stressful situation among diabetes patients. And my yeah, the last my last research finding, we found that we do observational study actually, and we observe in the effectivity of Indonesian honey to cure diabetic foot ulcer. And we actually use Indonesian honey, which is a local honey, and it is very accessible for many diabetes people to purchase. And therefore, we found that Indonesian honey in reducing diabetic wound size and also reduce necrotic tissue and also increase granulation and epithelialization. Well, okay, and we may a little bit go back to my topic in the first slide. Uh,
Mm.
and then in the first slide, I stated that I would like to share whether the health literacy may be become maybe a big challenge for undiagnosed patients, right? And according
mhm,
to my last findings in here in 2022, we found that among 296 people, we found that almost
mm,
99% people don't know they have risk of diabetes type 2.
mm,
Therefore, it is very dangerous for us. Uh, I
mhm,
would like to make an analogical way. If we
mhm,
have diagnosed clearly from the physician, yes, I have diabetes type 2, and it has been diagnosed from physician. Therefore, we may follow the physician suggestion, right? Because we already realized that we have type 2 diabetes. However, the big challenge, when we don't know we have the high risk type 2 diabetes. And it is very surprising me because we have more than 90% of people. And this study actually conducted in Tangerang. In Tangerang, it is only in Tangerang, Prof. Therefore,
mm,
it is very dangerous to know
mhm,
this kind of percentage. And
mm,
many people in Indonesia may have undiagnosed type 2 diabetes. And
mm,
if they don't know their conditions, they may not accessing the health information related diabetes, right? Therefore, according to this finding, uh, actually I have submitted my social activity program into technology ministry like Hibah, Prof.
mhm,
Hibah, yeah, Hibah Kemenristek Dikti,
yeah,
or social activity funding from our
mhm,
technology ministry in Indonesia. And according to previous data about undiagnosed diabetes risk, I have to I would like to develop the program. I would like to uh, disseminate how to assess the risk of diabetes. However, this method actually I would like to conduct among women in South Jakarta, Professor. So I would like to teach them how to
mm,
detect yearly as soon as possible
mm,
whether you have risk or not. So I would like to train them how to use ADA, American Diabetes Association Diabetes Risk Tools, which is a very reliable and valid tools. And this tools is very accessible for general population, Prof. Even not only for professional health provider, for general population, they can use these tools to detect their risk. And why I choose women
mm,
uh, being my target, because we know that woman is the nurse in their family, right? And also they are manage everything in their family. So I would like to empower women to detect the risk, diabetes risk, to their whole family.
mm,
So I think, yeah, and then yeah, before I close my presentation, I would like to share about the social activity in order to open access the health information among our populations. So we collaborate, we do collaboration with primary care services, Prof. And
mhm,
we do engage in Prolanis program. Not only we deliver and educate our diabetes population,
mhm,
but also we help them to detect the complication risk such as diabetic foot ulcer, and detect whether they have neuropathy risk. And
mhm,
not only we collaborate with healthcare services, but also we targeting also among underserved area or lower income population, Prof. So
mhm,
Actually, this community uh, consists of people who have who 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 do job like garbage collector, Prof. How to say
Hmm.
in
Yeah.
garbage collector? Yeah,
Garbage
actually,
collector.
these
Pemulung.
populations, yeah, is underserved community, and we do this program by educating them about how to detect our diabetes risk, and also if they have diabetes, already have diabetes, we also teach them how to do lower extremity exercise to prevent neuropathy, Prof. So
Okay.
as you can see in here,
Yeah.
we put several newspaper
Mm-hmm.
under lower extremity,
Mm.
and then we ask them to make ball, to make ball from from those newspapers. So
Mm-hmm.
we train their neuron peripheral neuron in
Mm-hmm.
their extremity, and increase the sensitivity of their neuron system in
Ah,
their lower extremity. So this kind of exercise actually is really good to prevent neuropathy among them.
okay. Right.
And
Thank
then
you.
we also applying monofilament test to early detection for neuropathy risk. Well, okay. And as my closing statement in here, Professor, as a nurse,
Mm-hmm.
by doing research, we can provide fruitful scientific evidence. And by doing a collaborative social activity, we can transform scientific findings into understandable information to broaden health literacy access for the population in need. Thank you very much.
Okay.
If you are, yeah, if you are
Yeah.
willing to contact me, you can use my email in here. Thank you.
Okay. Look, you are not only lecturer but researcher too. You are the patient with research, right? Okay, please stop screen first. Okay, Bu Anita, thank you. Look, Ibu Anita, not just only about the lecturer, but you are the researchers too, yeah, patient or as researcher. Congratulations. Ladies and gentlemen, before we go, very nice offer of PowerPoint. Wow.
Boleh nampak saya punya slide?
Nampak very clear. Tadi macam selain your picture ada lagi satu apa itu macam
Oh, belum nanti
uh,
dia akan.
oh jadi
Okay,
kena
this is
simpan dulu. Okey, itu
alright.
dia.
Okay.
Silakan.
Okay, Assalamualaikum. First of all, terima kasih Pak Reza. Thank you very much for inviting me as a speaker for today. So this is my brief academic qualification for you all to see lah. So my name is Mas Miza binti Zainal Abidin. Yeah. So for today session, I will share with you all on this. Yeah.
Okay.
On this diabetic foot care. So uh, this is our learning outcome for today. So at the end of the session, the student will be able to define the diabetic foot ulcer, DFU, state the etiology of DFU, list the food types of food problems in diabetic patient, state the prevention of food complications, state the purpose, assessment form, screening tools, and diagnostic investigation for food examination, and also describe the correct technique on food care. So let's go into the introduction first. Yeah. So food examination is part of an integral management of diabetes. So if the patient having diabetes for more than 10 years, they may develop food problems. So diabetes or diabetic foot ulcer, DFU, is developed secondary to chronic ischemia, which is insufficient blood supply to the foot due to microvascular, the small vessel, and also macrovascular, the large vessel complication because of diabetes. So apart from this, diabetic neuropathy, which is abnormal function of the nerves, also plays a role in the development of food ulcers. So that diabetic foot complications are the most common non-traumatic lower extremities amputation in the industrialized world. Thus, good foot care is very important to prevent serious infection and gangrene in diabetic patients. So now we go into the definition of this diabetic foot ulcer. Can be defined as an infection or ulceration or destruction of the tissues of the foot associated with neuropathy and or peripheral arterial disease, which is the narrowing of or blockage of the vessels that carry the blood from the heart to the legs of people with diabetic mellitus. So this is the etiology, what can cause a patient to have diabetic foot ulcer. First, because of the poor circulation or poor blood flow. Yeah, if the patient having long-standing high blood sugar, it can damage the patient blood vessel. When the patient blood vessel damage, it can decrease the blood flow into the foot, and it weaken the skin on the area, and it will contribute to the formation of ulcers. And if the patient having damage of the blood vessel and decrease the blood flow to the foot, it can impact the wound healing, because we know that blood circulation bring all the oxygen, the nutrient for the cell and tissue. So it may impact the wound healing of the patient. And presence of bacteria and also fungi on high levels of blood sugar in the bloodstream also can cause infection that can lead into skin breakdown and ulcers formation. Other than that, there is nerve damage, or what we call as peripheral neuropathy. Peripheral neuropathy of the foot is a common complication in patients with diabetes that also can weaken certain foot muscle, which further contribute to foot deformities. Elevated blood glucose levels over the time can damage the nerves of the foot, and it can decrease the patient ability to feel pain and pressure. So when they let's say they step into the something that sharp, they cannot feel the pain or the pressure from the sharp thing. Okay. Next is nerve damage, peripheral neuropathy. This predisposed to development of callus, pressure spot, and it will eventually injure the skin, soft tissue, bones, and also patient's joint. And over the time, the bone and joint damage that can alter the shape of the foot. Other than that is our footwear. Okay, if we wear poorly fitting shoes, it is also can cause diabetic foot ulcer, and it will start with patient will have like red spot, sore spot, blister, corn, or callus. And then those with foot abnormalities, such as maybe they are born with flat foot or bunions or hematomas, it also at risk of having diabetic foot if they have diabetic mellitus. Okay, and if they wear footwear that is inappropriate. Next is smoking. Okay, smoking also can cause damage to our small blood vessel in feet and legs. So it can damage and disrupt the healing process, and also it is a major risk for infection, and patient can lead into amputation. Other than that is trauma. Any trauma to the foot can increase the risk for a more serious problem to develop. So that's why if patient got trauma, they cannot feel the pain or the sensation. That's why the patient did not got the treatment from the doctors. Okay, next is infection. If the patient got athlete foot is a fungal infection of the skin, yeah, or the toenails. It also can lead to secondary bacterial infection, and it should be treated promptly. Or if the patient has ingrown toenails, which is occurs on the corner of the side of this toenail, it grows like soft flesh. It also must be handled right away with caution. Ini kalau di Malaysia kita panggil cekam. Saya tak pasti. Saya tak pasti di Indonesia kita panggil apa.
Ya,
Kalau
ya
ini kita
disebut
panggil
itu.
cekam. Sama
Cekam.
juga.
Dia namanya mirip-mirip itu, ini kena bekam, cekam.
Kita
Itulah.
di sini panggil cekam. Kuku cekam.
Right.
Okay. Okay, now we go to the food problems in diabetic patient. So there are many types of food problems commonly occurring among diabetic, such as like just now I show you, athletic foot, calluses, corns, cuts, blister, bunions. Bunion is enlargement of bone tissue around the joint at the head of the big toe. I will show the picture later, yeah. And then foot deformities. And also the patient with poor diabetic control and foot care, meaning that they did not took care of their foot properly, it will progress to foot ulcer that can range from a surface wound to a deep infection. So this is a common foot problems that might happen in patient with diabetes lah. So this is the athlete's foot. Yeah, this is the infection happen at the nails, the toenails. This is the calluses. Okay, and then this is the corns. This is the patient having blister, patient having dry skin. This is what we call as bunions, and also this is the foot ulcers. So how to prevent foot complication? We advise the patient to control their glucose, and also they must get treatment for their dyslipidemia, which is the abnormalities in cholesterol and fat profile, and they must also treat their blood pressure, and also they must know what is the appropriate footwear and how to care of their foot, and we must teach also them to do regular foot examination. We must educate them about how to take care of their foot. So now we go to the foot examination, yeah. So as half of the diabetic patient with peripheral neuropathy are asymptomatic, they didn't have any symptom, ya. Maksudnya dia tidak ada sebarang sign and symptom, mereka ada luka atau apa-apa, dia tidak rasa. Okay, screening is very important to identify those with diabetic foot at risk. So we have to do screening for peripheral neuropathy for all the patient with diabetes. In Malaysia, all the patients with diabetes, we will screen them for this peripheral neuropathy. So early detection and intervention of diabetic foot at risk will minimize complication and healthcare costs. Kerana itu bila kita buat untuk semua pesakit diabetes di Malaysia, kita boleh detect early dan kita boleh rawat mereka dengan cepat. Okay, this is the purpose of foot examination. It is to detect early changes and high-risk foot, to identify the risk of neuropathy or vascular complication, and also we can educate the patient and family on the proper foot care. So normally, the practice in Malaysia, we would do for all the patients with diabetes, the foot examination annually. So if the patient is at high risk of getting ulcer, we will do more frequent examination for the patient. So this is the assessment form that we will use to examine the patient's foot lah. So we will examine their sensation, and then we will inspect them for dry skin, callus, corn, fissure, skin changes, and the nail deformities, abnormal shape of the toes, past or present ulcer, and previous amputation. We will do for both leg also lah, for both foot, yeah. And then we also will do this vascular assessment. We will check their pulse at the dorsalis pedis, anterior tibial, posterior tibial, and also we will check for the color, the temperature, the capillary refill, whether the patient leg is having edema or not. And this is the intermittent claudication. Normally kita tanya kepada pesakit, ya, adakah they feel pain at dekat bahagian betis. Kita akan tanya mereka di belakang betis ada rasa sakit atau tidak. And then we will see whether the patient have varicosities, and also we will check for ankle brachial systolic index. This one we will use ultrasound Doppler untuk check peripheral arterial disease. And then this one is we will check for neurological assessment also lah. We will check for light touch, pinprick, monofilament, and also vibration and proprioception. So this is the screening tools that we will use for foot examination, we will use cotton, pin, microfilament, and also tuning fork. So this is a monofilament examination. Normally, we will use 5.07 or 10 gram monofilament, which exert a buckling force when it bends. So like this lah, this is the monofilament. So this one is to check the inability to sense the touch or pressure. So if the patient does not have sensation on touch and pressure, meaning that it indicates the patient loss of protective sensation. So this is where the test should be done lah. So we would check on the first metatarsal, third metatarsal, and fifth metatarsal, and also other recommendation site like in this picture lah at the green color part. Other than that, we will also check by using the neuropen. Yeah, neuropen also we have on the monofilament. This one 10 gram of monofilament lah. Is also to assess the touch and pressure sensation. And other than that is neurotip. This one we want to check whether the patient have pin sensation. So this one pin prick. We will use this for pin prick test. So this is a sharp. Kita di bahagian depan ni dia tajam. So kita akan tanya pesakit ada dia rasa sakit ataupun tidak bila kita cucuk. Okay. Ini tuning fork ya. Tuning fork we use to detect the loss of vibration sense. So we will place the tuning fork at the ankle and first metatarsal untuk foot sahaja. Okay. So this is how we do. We will tap the tuning fork and to create the vibration, and we will put on the patient foot, and we will ask the patient to tell us whether the vibration has stopped or not. So kalau kita dia dah bagi tahu stop, maksudnya dia masih ada rasa vibration tersebut. Okay, next kita akan gunakan cotton to assess the touch sensation. Kita tanyalah dia rasa ini untuk light touch. And also we will check for pulse lah, macam saya bagi tahu tadi, kita akan check dorsalis pedis pulse and we will see to the capillary returns. It should not be more than 2 seconds. Okay, ini adalah untuk check proprioception ataupun position sense. What we do is we will ask the patient to close their eyes, and then we will hold the patient's big toe, and we will move the big toe up and down, and then after that we move and we stop. We ask the patient di mana kedudukan, sama ada di bawah atau di atas ibu jari pesakit tersebut. So kalau pesakit mention benda yang betul, maksudnya dia masih ada rasa position sense tersebut. And then this is the diagnostic investigation that we will do for the patient. Normally, doctor will order to do X-ray and MRI, and also blood test if needed, and the ultrasound Doppler lah. So now I will go to this foot care. This is how we will teach the patient. They also can do it at home. Yeah. So we will ask them to inspect their foot daily. So they must check their foot for cuts, or they have any blisters, any corns, calluses, or cracks. So how they want to check? We ask them to buy a mirror. So they will examine their foot for by using the mirror. So they examine for each sole and also back of the heels. And if they notice any lesion, they should go and get the treatment from doctor as soon as possible. So what we advise on footwear, normally we would tell the patient they cannot walk with barefooted. Okay, they must buy or wear fitting and non-restrictive shoes, because we don't want tak mau apa itu kita bilang tak mau ganggu perjalanan darah, okay, blood circulation. We will check inside the shoe, ask them bila mau pakai kasut, kita perlu periksa dahulu di dalam bahagian kasut if there is any foreign object or any rough area inside, and then avoid using or wearing open-toed shoes, sandals, high heels, and also slippers. This is not advisable. So we can show to them, this is appropriate shoes that you can buy. This is not appropriate shoes for you to wear. So that the patient have clearer picture of what shoes they can buy and wear. On foot care, we will educate the patient on how to wash the foot with mild soap, and also when they after they have washed their foot, they must dry well, especially between the toes, because we don't want any germs dekat situ, ya. And then after they have already washed and dried the foot, they should apply moisturizer, especially for patients who have dry skin, because we want to maintain the moist. And then when they want to cut their nail or trim their toenails, we advise them to trim straight across with a clipper. So we don't want like this, yeah. It should be like this, straight across. And after they have cut their toenails, we ask them to use the emery board like this to smooth their edges and also the corners of the toenails. And if the patient have a corn or calluses, if they want to remove the corns and calluses, we advise them to use pumice stone. And we also advise them not to soak their foot into hot water or ice pack, because it can cause vasodilation and also vasoconstriction. Okay, so we normally advise patients to use lukewarm water. And then if they want to use sock, we will advise them to wear clean absorbent socks. So they must change every day. And when they want to sit, we tell them avoid crossing their leg, because it can impact the blood circulation. And we will encourage them to do exercise to promote the circulation of blood into the leg. So this is how we will teach the patient on the foot care. This is how we ask them to wash their feet and then dry it very well, especially between the toes, and apply the moisturizer. And if after they apply the moisturizer, they check for any calluses, any cuts or sores. And if they want to cut their toenails, like what I showed you just now, and then this is how they want to wear the sock. They must wear clean and absorbent socks lah. So this is how we ask them to do leg exercise. So those days, macam tadi Ibu Anita bilang, kita ada gunakan apa tu, paper kan untuk exercise. Tapi di sini sekarang kita tidak gunakan lagi paper. Kita sudah guna towel. Sebab paper kan ada carbon, so tidak bagus untuk kita find that benda tu tidak bagus untuk pesakit. Jadi kami sudah tukar kepada towel. So if you can see in this picture, they will use towel to do leg exercise. A small towel now. Okay, with that, I have finished my presentation for today. Thank you so much for listening to me.
Okay, very interesting sharing.
Okay,
Before right now there is some question in my email for you all, but before we read the question, I will to invite Ibu Nur Aini. Kalau can you stop screen first?
Boleh.
Bu Nur Aini dari University Nagoya, Indonesia. Sebelum kami ingin membacakan pertanyaan, mungkin Ibu ada yang mau di-highlight 10 menit terkait dengan apa yang sudah disampaikan oleh kedua speaker tadi, silakan. Mungkin ada komentar atau ada pembahasan. Sebagai komentator aja nih. Ya.
Oke, makasih Pak. Salam kenal Ibu Mas Meza ya.
Ya, saya.
Kak Malaysia, kami Kak Batam. Bila masa main kat sini lah, Miss.
Okey, insyaAllah bulan 8 saya akan ke Singapura.
Tinggal nyebrang, Miss.
Ya betul. Saya akan ke NUS.
Oke, sama Ibu Anita Soekarno. Oke, salam kenal Bu. Saya Aini dari Universitas Nagoya Indonesia Batam. Sebenarnya tidak ada komentator yang bagaimana ya, Prof ya. Soalnya kalau misalnya DM bukan hanya pada orang dewasa saja, tapi karena saya basicnya di kebidanan, di ibu hamil pun perlu kiat-kiat untuk menurunkan diabetes pada ibu hamil karena berisiko untuk bayinya.
Pada ibu hamil ya, karena pada bapak hamil kan nggak ada ya, cuma pada ibu hamil aja.
Bapak hamil Pak, tak ada.
Takut saya.
Itu masuknya perutnya bunci, maksudnya perutnya besar juga, tapi dia tak hamil, cuma dia obesity. Oke, Bu Anu, ini kita mau dengar pertanyaan sekarang dari Dwi.
Pertanyaan Pak.
Ya, Ibu boleh nanya juga nanti ya. Saya mau, atau Ibu mau nanya duluan boleh sebelum saya baca dari pelajar nanti atau belakangan.
Dari partisipan aja dulu Pak.
Oke. Baik, Ibu Anita, you can to copy me. I will to read the question for you from my email right now. Bu Anita, the first speaker, if you available, I will to read the question for you. Dia macam sedang ada coordination. Bu Anita, are you ready to copy a question for you, Bu? Halo. Macam dia lagi cakap dengan yang lain. Oke, I go. Kita tunggu kejap. Dia mungkin lagi bagi tahu nanti nak buka puasa masak apa ataupun Ibu Anita. Okay, masih. I will to read the question for you from my email. There is some question for the all speaker.
I'm sorry Prof. Saya ke distraksi dikit Prof. Tadi ada mahasiswa.
Okay, no problem because you are the lecturer must be to serve a student first. Okay, like me too. Ibu, ini ada some question in the email. Usually I chose 2 question only for the all speaker because limited time. The first from Dwi. Very interesting sharing, Bu Anita. I get new knowledge from your presentation. Okay. The first, many millennial or student right now as obesity group with lifestyle and bad meal. Usually, obesity relation with diabetes. Why obesity to high risk to become diabetes patient? This is the question. The first, why the obesity to high risk to become diabetes patient? This is the first question. And the second from Sari, how we know that we have symptom of diabetes? What can we do with smart action to manage if our family has genetic potential derivation diabetes? Hope you clear about question, Bu Anita. Right? Okay, right now the second speaker, I will to read the question to Puan Mash. Very good sharing, Puan Mash. Thank you very much. Okay, from Mela. Usually, many people talk that diabetes very significant relation with sweet drink, bubble drink, junk food, and so on. Is there diabetes must be impact of drink sweet or sugar contents? Dia tanya macam tu. Okay, the first question. And the second from Sari. Right now, many children has diabetes patients. What happened about it? They are not eat or more drink of sweet and sugar. What phenomenon in Malaysia regarding children diabetes patient? Is there so far so bad condition or better than Indonesia? This is the 2 questions for the all speaker. Miss Anita first to answer around 5 to 6 minutes, please.
Okay, Professor. Thank you for the questions. The first question is about what is the association between obesity and diabetes type 2, right? As I know from previous research findings, they found that increasing body weights may increase insulin insensitivity, which is insulin resistance. Therefore, there is no capable insulin hormone that can take the blood glucose into the cell, right? Therefore, it may increase blood glucose level. And the second questions about.
Sorry, I want to ask to regarding your answer. If someone is very good sport, I mean glad to exercise, this is there can to I mean to minimize of impact to diabetes.
Yes, of course, Prof. Definitely, because physical activity can decrease blood glucose level as well as improve insulin sensitivity.
All right. Therefore, while they are action by sport, not drink Coke or another like it. Yeah. Okay, thank you. Confirm. And then the second.
Yeah. If how we know about the risk of diabetes, right? Actually, like I explained previously, actually we have instrument to identify whether we have a risk of diabetes or not. Actually, you can access the website from American Diabetes Association, and you can look at the website, and you can find the instrument, the tools to identify you are at risk or not. And actually, these tools already had been validated among our population, and I did that, like I explained previously, among Tangerang population. And actually, this is a good instrument to detect uh, very easy to use, and it is understandable for general population. And
Sorry, ask.
actually,
Yes, sir.
there is 7 question in this instrument. Only 7 question, like have you have a family member that have diabetes before, or the other question, the other question, like ask you whether you have uh, hypertension or not. And they also ask you how much your body weight, and your index, body mass index. Therefore, we calculate the score, and there is a range of level that you can be defined as a high risk of diabetes. I think it is very easy question, Prof.
Okay.
Yeah, you can
Sorry,
access
sorry.
in American Diabetes
ADA.
Association website.
Yeah, ADA. Okay, sorry.
Yes.
As to what can we do with smart action to manage if our family has genetic potential derivation of diabetes?
Well, yeah, like one of research findings from my slides before actually uh, have presented the modifiable and non-modifiable risk factors for diabetes. For the modifiable one, are the factor that can be modified, right? That can be changed by several actions. If we have one factor from our family, therefore we should reduce this risk by doing other modifiable factors, such as physical activity, and managing our health diet. And also, do have if we do have accessible healthcare services to detect our blood glucose, I think it is a good to have medical check up annually. Therefore, we can know the number of blood glucose.
Okay, thank you.
Yeah.
Very smart.
Yeah.
Juan, you are no 2 questions
Okay.
too.
So for the first question, the students asked just now regarding whether sweet drinks can put the risk for patient to
Yeah.
have this diabetic, right? So normally, if the people, all of us consume sugar drinks regularly, actually we have a greater risk, about 26% to develop type 2 diabetes. Okay, so that one is for the first question. And for the second question just now regarding the children in Malaysia, right? If they drink sweet drink, whether they can develop diabetic. But normally, for children in Malaysia, they develop type 1 diabetic because of the autoimmune disease. This is not related to drinking sweet drinks. Normally, they have because of the autoimmune disease that can cause them to have type 1 diabetic. So on 2019, they have research done about 977 children develop this type 1 diabetic about age of 10 to 14 years old.
Oh, right.
So type 2 diabetic normally bukan disebabkan oleh minum banyak gula lah pada kanak-kanak. Tapi pada dewasa ya.
Kalau kanak-kanak lebih karena apa Puan dia boleh menjadi simptom?
Kepada type 1 dia type 1 disebabkan dia punya pankreas tidak menghasilkan cukup insulin. Ataupun dia tidak menghasilkan langsung insulin. That's why dia ada masalah tersebut. Ya.
Jadi
Di
dari
Malaysia
lahir dia
lah.
ada.
Ya.
Okay.
Ya, betul.
But so far so bad, so good.
Ya.
Okay,
Terima kasih.
Thank you very much. It's very smart answer. Right now, before we closing remark, we look the second song or for refreshing before closing remark. Indra Gumilang, are you ready to share the song by video right now for the reference?